Let's begin with Novo Nordisk suing Hims and Hers, accusing the telehealth firm of infringing its U.S. patent on key ingredient in Ozempic and Wegovy. Let's get the latest with Sam Fazeli. He's the senior pharmaceutical analyst at Bloomberg Intelligence. Sam, we were just talking on Friday, and you were telling us there is a danger to this. This isn't good. It sounds like Hims and Hers has finally listened to some of the criticism and threats coming from regulators.
Yeah, well, Daddy, the point here is not about one company listening to another to regulators. There is law. There is international law. You are not allowed to copy a drug that is still covered by a patent in the jurisdiction that you're selling the drug. Novo Nordisk's drugs are covered by a patent. That is the rule of law. You can't just go ahead and copy that. Whether it's safe or not safe, I know that is not incidental. Of course, it's not good if it's not safe, but it's just not the way that things work. Generic companies create a whole set of trials, compare drugs to the product that they want to compete with, then go to the FDA for approval. Here's a company that's just making them in the pharmacy, selling them to people. It's just not right. And I think finally we're seeing some logic creep into the system.
I'm here to tell you, Sam, don't put too much faith in international law these days. I'm looking at Eli Lilly shares versus Novo, and this is, I guess, a good day for Novo, but Lilly has absolutely trounced this stock, even though Novo Nordisk invented this whole sector of drugs. Where did they lose the edge? Where did Novo go wrong, and how has Lilly been able to dominate?
Yeah, so Lilly had two things going for it. One, they had a really good device when it was just in the diabetes space. And that device really helped them in terms of the injection pen. That really helped them get some good momentum. And then they took a gamble on this tirzepatide molecule. That's not, everyone calls them GLP-1s, but tirzepatide or Mounjaro, Zepbound is not just the GLP-1, it's two actions, GLP-1 and GIP. Nobody expected the GIP part of it to do what it did in the end, which is what has resulted in a product that beat Wegovy in a head-to-head trial. It's got better efficacy, higher efficacy, better weight loss, similar kind of side effect profile. So that, along with a good pen, and I'm not saying that Novo doesn't have a good pen, but everything lined up. And there's one other element here. Lilly has been in the business of selling products to the mass market type settings. Novo has been mostly specialist endocrinologists, if you like, diabetes specialists. So that perhaps has played into this as well. But Novo now has got itself a new head of US, which I think we'll see how that impacts things.